to the Lipoedema podcast. We are your hosts, Shell.
And Tiana, and today we have clinical nutritionist and special guest, dear friend to our heart. This is Megan Pfeffer. Megan, thank you so much for joining us.
Hello. Thank you so much for having me. So good to see you both.
Yeah, you too. It's been a while because you were one of our first guests, really.
Yeah.
You're in the earlier episodes of the Lipoedema podcast, and we're just so lucky to have you as a return guest to impart your wisdom once again on the Lipoedema community.
Oh, well, thank you
And
so
this
much.
time, we thought we'd tackle histamines because it was such a big topic in the Lipoedema conference in 2024.
Yeah.
And there wasn't much talk about it this conference, but still, I'm like continuously in the back of my mind, I still need to unpack so many questions that I have from the previous conference about histamines because I don't think I got a lot of it. It's all very technical.
Same. I knew a little bit about histamines, but not really how they act. So we thought, call in an expert.
Yeah.
Phone a friend.
Phone a friend.
Well, hopefully I can answer all of your questions.
Amazing. All right. So I guess at the very beginning, what exactly are histamines? And I suppose more importantly, what role do they play in the body beyond like hay fever and allergies? Like probably more than just a runny nose.
Yeah, I think a lot of people understand that runny nose and itchy eyes are associated with histamines, but histamines are hormones. So they're chemical messengers and they're produced by the body's white blood cells. They're released as an inflammatory response to injuries and an immune response to threats, things like foreign pathogens in the body. So your body also produces histamines for reasons beyond injury and immunity, including producing neurotransmitters to communicate with your brain to regulate things like body temperature and digestion and even your pulse rate. Histamines stimulate stomach acid secretion to aid digestion, and they play a role in female reproductive health. So excess histamine production affects the female reproductive system by stimulating excessive smooth muscle contractions, for example, and this can cause things like menstrual pain and cramping. Overstimulation of histamines can also produce excess estrogen. So there is certainly a link there, and we can get into that a little bit more down the track. But too much histamine in the body overstimulates other bodily functions too. So things like the digestive tract, which can result in one or more unpleasant symptoms such as loose stools, nausea, stomach pain. We'll go through some more symptoms as we go as well. But excessive histamines can produce too much hydrochloric acid, as we mentioned as well, and so that can cause things like reflux or even silent reflux. So people who might have symptoms like coughing or trouble swallowing or sore unexplained throats, and often there's medications given to stop that excessive reflux, to stop the cells you're producing that excess stomach acid. So that overproduction of histamines can also affect the cardiovascular system by causing excessive dilation of the blood vessels, and that can lead to, leakier vessels. So the dilation meaning, the blood vessels expand, and that can make them leakier. So, with people with lipedema, which of course we'll get into more of how that can affect people specifically with lipedema, can make that leakier blood vessel, so that fluid and heaviness in the tissues more present. And it can also cause things like low blood pressure. And I know, clinically I have a lot of my patients will have quite low blood pressure, and also things like face flushing. So there's lots of different contributors to that. A histamine intolerance, that might mean that your body's producing too many histamines, like with seasonal environmental allergies, or even at, the onset of monthly periods of menstruation. But it can also be caused by ingesting too many foods which are high in histamines, or foods that can liberate histamines in the body. And there's some people who might have a genetic variation, which means that they produce an insufficient amount of the enzyme, which is called DAO, which is required to break down histamines. So there's that element as well. And then that can slow down elimination from the body, while other people might be eating too many foods that block DAO production, that enzyme production. And there's also things like medications that can interfere with the process. So this is where it can get really confusing for people, because often people just want, just tell me in one sentence or less what's going on. And you really can't, because there's so many contributing factors. It will look different for lots of people for lots of different reasons. And there's also a lot of other factors that we'll get to as well that really can exacerbate that. Yeah, so lots of other causes of histamine intolerance. I don't know if you want me to sort of go through a few of those now, or if you want to get to that.
Yeah, I mean, we definitely want to unpack that. I'm still like absorbing that, you know, that, the Lipoedema conference in 2024 was probably the first time, other than an antihistamine for hay fever, that I've heard about histamines. Yet what you've just demonstrated is that it can be caused by a myriad of things. It can present in a myriad of ways. And like there's so much interplay with it. So it's fascinating that I haven't really heard about the complexities before.
Yes, it's interesting, isn't it? And even just things like being, I know that while we were away at the conference, just being consistently in that really warm room. So things like heat can aggravate its stress. And quite often we know there are a lot of contributing factors, but then we also talk about not only the histamine intolerance, but also things like MCAS or mast cell activation syndrome, which can be associated with lipedema. And so we'll have a look at that as well.
Yeah, awesome. I suppose to kick us off with that, how might like histamine levels or a histamine intolerance, as you mentioned, show up differently in someone specifically with lipedema? And like, are there symptoms that could be easily misread or dismissed? Because it sounds like there's a lot of symptoms.
Yeah, certainly. There are a lot of symptoms, and sometimes the symptoms can very much look similar to hormones or stress or perimenopause or just normal aging. And sometimes symptoms can be dismissed as those things. And this is where the complexity of being a clinician comes in, and why it's very hard to just give a one-size-all approach. Because is someone perimenopausal? Where are their symptoms coming from that? And this is where we will work in conjunction with other health professionals, where you want to have your hormones assessed, and then we also want to look at your gut health. And there's, a lot of different things that can contribute. And stress, it's always about lifestyle as well.
Wow.
We know that histamine intolerance is less about making too much histamine, although in MCAS that is typically about making too much histamine, but it's more about not clearing it well enough. So in lipedema, numerous contributors such as gut health and lymphatic health, because some people have really sluggish lymphatic systems or they're not working well at all if they do have secondary lymphedema as well as lipedema. But also, connective tissue plays a large part in it. Histamine receptors are all in different places throughout the body. Hormonal shifts will impact that as well. So some people will find that at different times throughout their monthly cycle that they can be a problem. I've had clients who might have thigh-high compression garments, for example, and they start at certain times of the month that pressing in of the skin will bring on, histamine type symptoms.
Wow.
So some common patterns that listeners might recognise, and with symptoms, it doesn't necessarily need to be all of them. So it's not like you have to tick every single one of them for this to be an issue. Things like itchiness or skin crawling with or without a visible rash. So sometimes there'll be hives and that type of thing as well. But flushing of the face and heat intolerance, heaviness and swelling that worsen late afternoon or after heat or hot showers or exercise. And we know that with lipedema, they can certainly be at play. I know that for me, they're absolutely key times. Things like brain fog, and brain fog, of course, can be connected to so many different things. We know that with perimenopause, that brain fog can start coming into account. We know with insulin resistance, brain fog can start coming into account. If we have poor gut health, blocking neurotransmitters, that can affect. It doesn't specifically mean if you have brain fog, it means histamine intolerance, but it's one of the things that we start putting pieces of the puzzle together to work out what's going on. Headaches and migraines, again, can be triggered by many things, but they can certainly be part of this picture. Heart palpitations or anxiety, heightened anxiety, and particularly when after certain foods. So things like wine is a fermented food. Eating leftovers, sometimes I find with clients that when we actually track down how often are they eating leftover foods, that tends to be when they're not feeling well or after just really stressful days. Bloating and IBS type symptoms, so certainly things affecting gut. Allergy-like days, but with no pollen around. So sometimes when you'll speak to people and ask them about their allergy type symptoms, and when you investigate, they're actually having it a lot longer than just in spring when typical allergens are around, or the times of year that the particular allergens are at play. It's going on a lot longer and without those specific triggers. Sinus congestion, those period-linked flares, and sometimes, looking for those multi-system repeatable triggers for things like heat and alcohol, fermented and aged foods, leftover foods, poor sleep, not just looking for things like itchy skin, runny nose, that type of thing. Leaky gut, of course, is a big one, and I find that sometimes people will have histamine intolerances to foods just because their gut health is not great. So sometimes you
Right.
start developing these food intolerances that is, because you might have this leaky gut where suddenly, we have tight junctions in our gut, and if things that can affect those junctions that can start allowing larger proteins and molecules and things or gut microbes to get through that shouldn't be getting through, that can be really problematic. And so suddenly people can start developing food intolerances that haven't had them before. So they're no longer tolerating something they've always been able to eat.
Yeah.
Oh gosh, it sounds so complex. And you're talking through what we might feel, or like this, I suppose, the symptoms that we might have. But it also makes me think, like, with our hormonal cycle and how we might get, itchy or cranky or foggy and at certain parts of our cycle. Is that PMS, or is that perimenopause, or is that something to do with our histamines, or is it both? How would you even differentiate that?
Yeah, well, I think that's where, for me, when I'm seeing clients, that before they see me, I have a very specific intake form that asks them about all kinds of different symptoms, because we're not just looking at, specific things and missing this whole big picture. So I like to see that whole big picture. And once you've got all of the different symptoms that are there, it's like starting to put pieces of the puzzle together. It's an investigative journey to find out what could potentially be causing those types of things. And so you really can't identify that without knowing the whole history and what other conditions someone has and what is their sleep like and what are all the contributing factors and potential triggers that could be there. And then, of course, once we establish what someone's symptoms are and what their health is and what types of medications they're taking, because that can affect things as well, over-the-counter medications as well. And then I like to look at what types of foods they're eating, because once I understand someone's health and where they are and their symptoms and how they're feeling emotionally and physically, I then look at the food sort of towards the end to say, okay, what types of foods are you describing that could potentially be linked to some of those symptoms that we've discussed?
Yeah.
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 You have
So,
a very hard job.
Like a
yeah.
fact-finding mission, like you get all the
Yeah.
information and try and decipher everything. And I don't because I've had histamine issues throughout my life, and I always think of it as a bucket. Like, depending on how many histamines I put in that bucket, depends if I'll have a reaction or not. Like, so I could get away with little bits, but once I put too much in my bucket, then I'm in trouble. I don't know,
That's
that's
right.
just a visual for me.
Yeah, and it's a fabulous one, because we know that the poison is always in the dose, so to speak. So anything
Right.
that you can potentially have trouble with will always come down to can you tolerate this much? But if you have that much, then it's a problem. A classic example of that is lactose intolerance, where people lack the enzyme to really break down, lactase is the enzyme that breaks down lactose. And so you might be able to tolerate a little piccolo latte and have that and enjoy that each day with milk. But if you have a regular size latte, that's just too much, and it triggers things. So histamines can be similar, depending of what's going on to those. So sometimes it's just the intake of the histamine foods that you're having, but sometimes even that's going to be problematic if you also happen to be having a hugely stressful period and you also have had rounds of antibiotics that can also, that create dysbiosis in the gut, or someone might have SIBO at the time. All of those things are also going to influence that. So again, you might have been able to tolerate X amount of things like histamines, but suddenly you've got all of these different stresses affecting it, and that could then change
Yeah.
that. Yeah, exactly. So, and it's not just about those obvious symptoms, as we spoke about, that the histamines can cause the swelling and open up the blood vessels more to make them leaky. So that's great for an injury response when the body's wanting to send around a whole lot of chemicals to help repair something, but it's not great when it's chronic and ongoing. And so we were talking about, if you're feeling inflamed or heavy or foggy or itchy and that type of thing, then absolutely those leaky vessels, that's more fluid escaping into the tissues that can lead to more puffiness and limb heaviness. So that can, really accentuate that. So that's not to say that in itself is what's causing limb heaviness in lipedema, but can it be aggravating that? Absolutely. And then when you think about, if people are eating a lot of high carbohydrate foods, which are things that break down to sugars, and that can be, simple sugars, the obvious sugars, lollies and table sugar and that type of thing, but also the more complex sugars, things like the savoury sugars we call them, which are, your potatoes and pasta and crackers and those types of things that people often don't, rice, people often don't think that converts to sugar. But that also makes that glycocalyx within the blood vessel lining leakier. So if you've already got a potential towards leakier vessels, which in lipedema we do, and then we have things like histamines aggravating that, and then we have things from our food aggravating that further, those things really add up and make a difference. And then add in some hot weather and some travel and a glass of wine, and those things can really make a big difference. I know that for me, I used to really have a lot of trouble on days where it would be really hot weather. If I was at someone's place for dinner where they were feeding a lot of carbohydrates, you might have a glass of wine and my legs would be so much heavier, my ankles would be puffy, my feet would be sore, would really have a big impact. So that can look different for everyone. But of course, then there's that tenderness or pain, increased pain level, and we know that this is an issue with lipedema already. And so whether this is, can be something contributing to that or contributing to potentially the cause or just contributing to it being exacerbated in some people. Histamine can sensitize nerves, so it can change how people feel pain or pain upon pressure or pins and needles or even burning sensations. So then there's histamines in the brain. So brain fog can be influenced by things like the histamine receptor 3s in the brain, which influences things like wakefulness and sleepiness. Sometimes, people take antihistamines, and the older sort of style ones used to make you feel really sleepy because it was so it really has an impact there as well, and on neurotransmitter production. So, so that can leave you feeling really flat and foggy as well. And then there's that sort of inflammation loop with it all as well.
And inflammation is separate to histamines. Like, you can have inflammation without having an histamine dysregulation, I suppose. And could you have a histamine dysregulation and it wouldn't necessarily show up as inflammation?
Well, histamine does recruit more immune cells. So no, I think really is part and parcel with histamines. So that histamine recruitment of immune cells leads to more inflammatory chemicals and more connective tissue remodeling, for example, which, we know is also a big thing in lipedema. So that can make the tissues sort of the body more reactive and that chronic long-term inflammatory response at play.
Isn't that crazy? Like, two of these systems that we need to survive. But if you have too much of them, my goodness, they make you have a really bad day.
Yeah, really bad day, really bad year or more. In fact, I know it is incredible. But, the immune system, I think that's where we take our health for granted for such a long time until things start going wrong. But as we age, if we're not doing things to compensate for things like having antibiotic therapy and, not looking after our gut health, then we're going to start having different immune responses. That leaky gut that we were talking about, where those junctions become a little bit looser and things can filtrate through that shouldn't be filtrating through. It's hypothesized that can potentially be contributing to the start of autoimmune conditions because these larger proteins can be getting through and the body starts turning on its own protein. So the immune response, which protects us every day, can also then, be,
So when you say getting through, do you mean like it's breaking through that wall and going like into our bloodstream? Like where are these
the blood
going?
Yeah, it can get into the bloodstream, and that initiates an immune response. So you'll be going through and getting into the tissues and the bloodstream, for example.
Yeah, so that's when your body's like, something's wrong. We need to send in inflammation and histamines to go look after it.
Yeah, it's like this shouldn't be here, and initiates a response to deal with that. There's things in places they shouldn't be.
Gosh, it's really, I'm just still
Fascinating.
fascinated by how complex it is. Um, and I suppose even more complex as we live in a female body with the female hormones and everything. Is there any known connection between estrogen and histamines?
Yes, there is. So estrogen can ramp histamine up, so it can make mast cells more likely to dump histamine. So estrogen can slow the breakdown of histamines as well, because it can reduce that activity of DAO, which is that enzyme that helps to break down histamine so that we can eliminate them from the body. So that DAO is the gut enzyme that clears that food-derived histamine. So things like puberty and pregnancy and perimenopause, where symptoms can flare with those shifts in hormones, and people may notice that classic wine and cheese sort of combination can be worse at different times in their cycle, and that's where it can be really
Pizza
good.
and beer. I was never able to join in pizza and beer nights when I was in my 20s.
Right.
Yeah, I stopped having alcohol altogether when I was about 25 because I just recognized that my body just couldn't handle it. And I would have
Mm.
one, you would see this big rash come up my neck and I would feel
Yeah.
hot and it would just be so uncomfortable. And then for 2 or 3 days, I was just suffering, even if it was just one. And I'm like, this is not worth it.
Not
Although on the gala dinner at the Lipoedema Australia conference, I did have a couple, and I didn't quite suffer, which was interesting. And I suppose it's because I don't have it. I mean, the last time I drank was probably a few years ago, so I guess I don't. The bucket is still there's
Yeah.
still some room in the bucket for a couple of wines once every few years.
Yes, and
And
I
you
was
were
going
eating
to.
amazing food all
Oh,
weekend, Megan. We did a shout out for you and the amazing food at the conference.
this is delicious.
Sorry,
Well,
we're getting
it was lovely, wasn't it? I really enjoyed it as well. There's not many conferences you can go to where it's catered to that sort of low carbohydrate, which really helps to keep people awake for the rest of the day. When you're in a warm building, to be loading up on sandwiches and that type of food that makes you sort of want to take a nap is not conducive to wanting to listen to awesome information all day.
Yeah, you want to be energized to take it all in.
So
Yeah.
true.
Yes.
Okay, so people with lipedema specifically, do we tend to have higher histamine levels, or is it about like how we process or absorb or like deal with our histamine?
Well, I think it can depend on a lot of things. I think with lipedema, and this is an area I've flagged to do some further research and work a little bit further on our hypothesis paper, because we do have other histamine receptors, that work with fat cells, for example. So if we have a lot of additional fat cells or really enlarged fat cells, then that is going to it's going to interact differently with histamine and have a different response. That's something that would be really interesting to look a lot further into. Of course, the thing with lipedema is that we're so limited with the studies that we do have, and so there are so many different elements that we don't know, that we can hypothesize. And at this stage, even doing that is really important, because it needs to initiate further areas of, or just that sort of that mind mapping of looking at different ways that things can be affected that we haven't perhaps thought of before.
Yeah. There was talk of mast cell activation syndrome, or
Yes.
MCAS, being common in lipedema. Can you explain what mast cells do and how they relate to histamines and lipedema?
Yes. So with the MCAS, or the mast cell activation syndrome, that really means that mast cells are releasing their chemicals. So the mast cells, remember, are part of the immune system. They're white blood cells that release chemicals too easily or too often. So triggers can be a lot of those different things like heat and cold and stress and infections, hormones, even things like smells, and usually that mixture of triggers. So it can show up as flushing or hives and itchiness, headaches and migraines, all of those things that we really spoke about before, but it can happen more frequently for people with mast cell activation syndrome. So it's much more intense, and it can't be as controlled as perhaps a histamine intolerance with foods, for example, can be. It's going to have a much more pronounced response.
Gotcha. So it's like the extreme.
Version of histamines. It's like the next level.
Yeah.
Next
But
level, yeah.
we need mast cells. Like, what's mast cell are there to protect us as well? Just like
Yeah.
our histamine, just like inflammation, like they've all got that protective job.
Absolutely, part of the immune system. So part of that innate immune system as well, that it's there to, as a responder, to go to send out, it's an alarm system. It releases a whole lot of different chemicals. Histamines is just one of them. So that's where with mast cell activation syndrome, sometimes there can be other chemicals that are at play as well, and not just the histamine. So histamine intolerance tends to be more about histamine, and whereas mast cell activation syndrome can be more than that. So sometimes just making changes to the way someone eats isn't enough. We need to be addressing lifestyle and all of those types of things that can contribute. And it tends to flare up more so for people who are under a lot of stress and where they have a lot of those elements all coming together at the same time. And, if they are eating a lot of foods that are high in histamine or foods that liberate a lot of histamine, then that can sometimes make that all worse.
Yeah. And should we be then looking at our diet in relation to histamines and choosing lower histamine diet?
Yeah. What does that even look
What
like?
is that like the anti-inflammatory? Like, are they similar? Are they have any correlation?
Well, so the foods that are really high in histamines are going to be aged and fermented foods. So when foods are fermented or aged for a long time, that the histamine levels increase. So fermented foods, have a more sort of microbial type foods. And so just like with our gut health, if we have dysbiosis, which is that more about the microbes and the imbalance in that, can be problematic. So that's going to include things like aged cheeses, really aged cheeses like Parmesan cheese or a vintage cheese. People find that they're not feeling that great when they eat those foods, or it might be that, have small piece, again, that, cup is full type thing. How much they have a day of eating. A lot of them, someone's put out a charcuterie board and they've really gone to town on that they're noticing suddenly they're really not feeling well. But things, of course, like yogurt is fermented, kefir is a fermented food, sauerkraut and kimchi. And a lot of people are adding these foods in because they think, they're good for you, which
For their gut.
they often can be good for your gut. But if you're having gut issues already and histamine responses, then that could potentially be making it worse. So that can be another symptom to look out for. That have you tried including things like apple cider vinegar or, kimchi, or even soy sauce is fermented. Vinegars aren't great either. So if you've tried including those types of things and actually you haven't felt well, or you've found that it's worsened some of your symptoms, then that's something to be mindful of. So things like cured or smoked foods, so salamis and bacon and ham, smoked fish, those types of things, beer, champagne, wine, fermented alcohols. Seafood can be really problematic unless it's snap frozen, and sometimes depending on if it's MCAS, all fish will be problematic, and it can be really hard to find salmon, for example, that's been snap frozen right on the boat. And that's what it will need to be for some people. So whereas for other people that may not be such an issue. So this is where we really need to, it's not something to self-diagnose. I don't think it's not something to, you can, cut back on some of those things, but as we mentioned, some of those things are really good for you. So we don't just want people taking away everything. And as we know with lipedema, there's already so many recommendations of what foods we should and shouldn't be having. People are really scared about what to eat. They're confused. And so this type of information can make people feel even more overwhelmed because they're already unsure of what to eat. And now we've probably just crossed off a whole lot more things that's not on that list. So we're certainly not saying that everyone should be having those foods. So I really want to emphasize that it really does depend on someone's symptoms and also the amount that they can be having. What other foods are they having that contribute? Are they having medications that are contributing? Yeah, so that all of those things are going to are going to make a difference. But leftover foods, as we mentioned, that can be really problematic. Histamines build up on leftovers. So if you're batch cooking on the weekend and having foods for the next 5 days, even just sometimes changing that to flash freezing portion sizes and defrosting it really quickly and then, heating it up really quickly. For some people, that's enough to help their tummies settle down.
Can you just explain what flash freezing is? I always thought when I batch cooked, I thought I had to let it cool down first before I put it in the freezer. Is that still like, can you explain that a
Yeah,
little bit?
so you do still need to do that. So chilling something sort of as quickly as possible. So to me, that means not just leaving it in the pot on
Mhm.
the hot plate where it's been cooked that really retains all of that heat. You transfer it into something else. You might put it into a glass or ceramic container and put it into a sink with some cold water
Okay.
around the base of it, and that's going to really bring the temperature down much faster so that you can then get it in quicker. Melbourne and Victoria, we just have to perhaps leave the pot in the garage for, for
Yeah.
a little bit. It'll be cold it'll be chilled in no time. But for those of you in Queensland, you might need some of those extra, a bit of ice
Yeah.
in the water. uh,
Yeah, I remember seeing a post about that, about your leftovers and the histamines, and I got really frustrated because I was like, we are told to, to save our time to batch cook because we need to make sure we're eating enough protein. And now you're telling me that I can't have leftovers. And I was like, what's a girl to do? How are we supposed to do this? And then
Yeah.
Shelly explained to me that it was just getting it in the freezer as
Get it in
quickly
the
as
freezer.
possible. And I was
Yeah.
like, okay, then I'll just
yeah,
down off my little high horse and
yeah.
shush.
And
It was
also,
very frustrating.
yeah, absolutely. So it's good to clarify those things. But I think too that if you're not really someone who has any symptoms and you've got your swelling and fluid retention and things like that are under control and, wearing compression and you're not getting that heaviness with your legs and, just that that things are feeling quite well managed. But I think people are quite aware when they are having symptoms. Sometimes people do normalize symptoms too because, of course, we want to dull down the noise. So we just kind of move on and get on with things. So we want to make sure that people are kind of in tune with what their symptoms may be. But if there's any type of gut symptoms or skin symptoms or, symptoms anywhere, it should be looked at. And, someone like myself, a clinical nutritionist, can help you figure out what's going on so that you're not having to necessarily remove things when you don't need to be.
You don't need to, yeah.
Yeah. Stop self-diagnosing with all of these things every time you get a sniffle or something else. Go and see an expert.
Just go see Megan.
Go see Megan. So are there tests that you can do like for histamine and mast cell or is it more of that detective work and trying to figure it out?
Look, I think it is more of the detective work. If someone's having really extreme symptoms, there are some tests that can be done. Certainly, like DAO is an enzyme, so a genetic test to see whether you have an issue with that enzyme. And for some people, it might be as simple as taking a DAO supplement, which you can do, which may help to eliminate some of those histamine symptoms. Some people may also need to have a look at what foods do trigger excessive histamines, or just try not to incorporate too many high histamine foods, and make sure that you might be saying, okay, well, actually, I've had some high histamine foods with breakfast, so maybe I'll back off for lunch and dinner and those types of things. But there are, plasma histamine, there's 24-hour urine tests and other things like serum tryptase, but they often don't help unless you're specifically having a flare at the time.
Right.
So that's where it can be difficult as well to actually be dealing with that right at the time that it's happening. And really, MCAS is largely a clinical diagnosis. So that's really looking at that pattern recognition, ruling out other causes. But yeah, some of those tests may help to clinch that diagnosis as well. But that's really specialists that will be looking at MCAS diagnosis. That's not something that I would diagnose. It might be something that I will say, hey, I think there's enough clinical evidence here for me to refer you to a specialist to look further into that. And quite often for the people that I do that with will indeed come back with an MCAS diagnosis.
Such a good point that you mentioned the timing of some of these tests, and it's not just for like MCAS. I can think of other things. I can't think of it right now, but I can think of other things that like the timing is really important to get those tests done. Like, so if you know you see someone like Megan or a clinical nutritionist and they suspect that you have MCAS and you need that diagnosis, maybe wait until you're in a flare to get those tests done, which is annoying because you know we
Last
all
thing you think of doing when you're not feeling well is having to go get tested.
yeah, and you got to book it in. Like, when are you going to book in?
That's right. But
I'm gonna
sometimes
have this.
Or I'm going to trigger it. I'm going to sit down and I'm going to eat some wine and some cheese, and I'm going to have last night's dinner that I haven't frozen.
Yes, I'm going to have my spaghetti bolognese with a bunch of parmesan and a red wine from last night's dinner and trigger my response, and then I'm going to go and get tested.
yeah. But obviously, too, it's a delayed process. So having mast cell activation syndrome diagnosed, for example, it can take sometimes 12 to 18 months to get in with specialists to see them. So it's not something that you can easily time. And you would want to be getting on to some managing those symptoms before that in the process, and hope for an early cancellation with that. Yeah. So it's something that you really, if you have symptoms of any, it's good to just, it's good to get onto them and start managing things. And for me, I think too, where I usually start with people is to pick out the types of, given their symptoms and their health and their blood tests and their supplements and medicate, all of those things, when we look at that holistically, is to remove the things that I can instantly sort of recognize are potentially going to be causing problems, and taking that away and changing the foods, the types of foods that they're having. And then just kind of stepping back and seeing, okay, how does that change your symptoms? For some people, that alone is enough to eradicate symptoms that they've been living with for 10 or 20 years. There can be some simple fixes sometimes, and for other people it can be much more complex. So I always like to start gently at first with food tweaks, take a step back, see how things settle down, and and then kind of get to the next level of, okay, things are still at play, what other symptoms are left? And it really is sometimes an elimination process. And sometimes I do put people on a histamine elimination protocol, which can be quite daunting, like any elimination protocol. You only use it if you really need to be using that. If you can't get to it with other, other changes and other, techniques that we use. But the point with that is to then eliminate things so that the triggers are removed, to eliminate the symptoms. And then once the symptoms have settled down, then we do some gut healing and some other protocols that mean that we're then kind of going into the root cause, helping things there. And then we start an elimination protocol, which is really important. And you find this with people on FODMAP diets, for example. They stay in the elimination phase for the rest of their life. And that's not really what it's designed for. It's designed to reintroduce foods in a really controlled way so that we can actually see what each one, and not only what each specific food is doing, but what that cumulative response is. So you have it one day, it might be fine. You have the second day in a row, it might be fine. You have it the third day, it's too much. So coming back to your point, Shelley, with that bucket effect. Yeah.
Wow. Feel like it's complicated, but it also, the power of like what we can do is quite nice. You think you could be getting all of these varied symptoms, you'd be having a really hard time. And if you just change out some of those foods just to see, there's no issue in getting rid of a little bit of red wine, the red wine for a couple of weeks or something. We may find something specifically that's going to make our life so much better just by eliminating a couple of things and not having to go all the way to a full histamine elimination diet or the FODMAP type thing. So it does give us a little bit of power back, I think.
Without being too restrictive. Like Megan said, just making some tweaks, simple tweaks that don't make us feel restricted and punished.
Yes, and that's why it's worth looking into it if you do have those types of symptoms going on, because we all deserve to enjoy our food. We all want food abundance, but we also at the same time need to recognize, particularly as we age, each decade that we go into, our bodies change and evolve, and we need to have a look at, check in with ourselves, I think, and say, okay, I'm now in my 20s, what's changed to my 20s, and particularly going into 40s and our 50s, what's going on now for this decade moving forward? How is that going to affect what I'm doing, and how do I need to look after my body in a way with nutrition, nutrition and lifestyle and exercise and those things that we know make such a big difference. Because genetics, for example, as we're talking about, genetics like DAO, which is involved with histamine intolerance, genetics loads the gun, but it's lifestyle that pulls the trigger. And so managing the lifestyle in a way that can still give you a sense of freedom, a sense of enjoyment, but that honours your body and what your particular body needs is really, I think, what it's all about.
Yeah,
I love that.
And I guess as we wrap up this episode, and we've delved into quite a complicated topic, I think, it took me a while at the beginning of this conversation to sort of get a handle on it. And, our systems are so complex, especially as a woman, our systems are even more complex as we age. Every decade it gets a different kind of complex. And what I'd like to challenge you with, Megan, if you can, is give us one or a couple of things you wish more people with lipedema and the clinicians treating us understood about the role of histamines in our condition.
Well, I think just, it would be so nice for everyone to realise that every symptom tells a story. And if we're not looking at that holistically, we're sometimes missing those very things. So just assuming that someone may be having fat malabsorption, for example, where actually there are histamine issues, people with lipedema do have more inflammatory issues. And so, there are a lot of other factors at play. We need to look holistically always, I think. And I think just so that people realise that symptoms do tell a story and they need to be looked into, to not just keep dismissing them.
Great point. And then it comes to mind, like, that's not the role of our GP in a 10-minute appointment. Like, we really need to come to someone like you, a clinical nutritionist, an naturopath, or somebody that deals with the whole person to try and nut that out with, not a 10-minute GP appointment.
And if we always have a very detailed symptom checker or something like that before we go and see someone like you, Megan. So you get that background on us before we come for our hour session. So you already have this background, and then we have an hour to sit and chat. Like,
it's way different. Well, with me, it's actually an hour and a half that first. And for people with really complex health issues, sometimes that runs into nearly 2 hours, because you can't just get through all of that base information to really know someone well. And women with lipedema can be really complex, have a lot of complex health issues. And so you have to afford someone the time to tell their story, but also to really understand their health history and where they are now, to really help them navigate that with moving forward.
Yeah, that's right. And I guess while they're talking to you, you know the questions to ask. So you're pulling the threads to get to more answers and to figure it all out with them. And that can be really therapeutic to share with somebody.
It can be.
What you've been going through and not being dismissed for it.
Yeah.
Absolutely. And in fact, part of the healing process starts with being able to share your story with your health practitioner. Studies will show that in itself is part of the healing journey. So for the women who have gone through so many years of medical misogyny and medical gaslighting, of not being heard, you can't tell your story in 10 minutes when you have complex health issues. So you go to the doctor to be assessed for certain things, you have your blood tests done, those types of things. But outside of that, you really want to be going to someone who can spend the time with you to go into as much detail as is needed.
Yeah. You need a lot of diversity in your care team.
Yes, absolutely. And that is a big part of it with lipedema, as I would tell most people, is that once you find your healthcare team to put around you, once you've got your physio, your lymphoedema therapist, and if you've got your clinical nutritionist, and you've got a great GP that knows about lipedema or is willing to learn about lipedema, once you've got those people in place, it's makes such a big difference to navigating this for the rest of your life.
Yeah, it's a great point. Yeah,
we need a team. Yeah.
Yes, exactly.
All right, Megan, before we sign off with you, where can the lipedema community find you to go on this journey and learn about
unpack it all.
unpack the histamines and the inflammation and the gut dysbiosis.
Well, I consult online all over the world, and my company's called I Choose Health, and so you can head to the ichoosehealth.com.au website to find out more.
Amazing.
Awesome. I'll put that in the show notes.
Thank you so much for joining us again. We look forward to many more conversations with you on the Lipoedema podcast.
Thanks,
Thank you,
Tiana and
Megan.
Shell. Great to see you. Bye.
You too.
Bye.
The Lipoedema Podcast 2025 is powered by Elegance Lymphatic Care. Lipoedema and its symptoms vary from individual to individual. The opinions and advice voiced in this podcast are of a personal nature and used for educational purposes.
Please take away from this podcast what resonates with you, and please see your GP or preferred specialist for diagnosis and healthcare. We are Shelley and Tiana from the Lipoedema Podcast. Until our next episode, bye for now.